Cori, thank you very much for joining us for our Learn Together series.
Of course.
Thank you guys again for coming to chat or listen, ask questions. As you saw of the preview video that we had, Cori's our alum here, and the Learn Together series is essentially hearing from alum who were just in your shoes a few years ago, right? And she's going to share where she's at now, her experience that she had at GPH, her journey, and any insight or advice or that she would have and be willing to share with you guys. That's really what this Learn Together series is about. So I'm really happy to have Cori here. And let's get into the questions. So if you could start by telling us what you're doing now, your role, the company, and what public health challenges you're working on currently.
Yeah, so I work for Partnership to End Addiction. I'm the Director of Prevention Services there. And Partnership is a national nonprofit, but headquartered here in the city. And Partnership is trying to support families who have been affected by the addiction crisis, but also do a lot of prevention and treatment work. And so in my prevention team, we are training parents and other prevention professionals and what they need to know in prevention science to try to make it so young people don't use substances to begin with and don't become addicted to substances. So we're trying to do primary prevention, create healthier, more supportive environments for young people to grow up in so that they don't engage in risky behavior in the first place.
Right. And what initially drew you to the field of substance use prevention? And then how did your experience at GPH shape your path towards that role?
Yeah, so I was very interested in substance use kind of from the beginning. I'm from North Carolina. My hometown in North Carolina was hit really hard by the opioid crisis. I had a lot of personal connections to it, so I always knew that that was something that I was interested in. In undergrad at Tulane, I studied public health, but Tulane is very neglected tropical diseases, tropical medicine, infectious disease focused, which was very cool, but I was like, that doesn't really seem like the kind of public health that I was really drawn to. So went straight to GPH from undergrad and then started taking so many community health classes. And I took some classes in like mental and behavioral health, incarceration health, and really kind of curated my interest from there. And so then on graduation, I was like, I just want to find something related somehow to these topics that I'm interested in. And so Partnership to End Addiction came along, which really kind of felt like a perfect combination of my interests.
So you had an idea of what you wanted to do, but weren't too sure.
Yeah.
But the classes kind of solidified.
Yeah, so I knew kind of what topics I was interested in, but I didn't know exactly what I wanted to do within those topics, whether more of kind of like an epi route or kind of on the public health practice, program planning side. So I kind of threw whatever into the wind and trying to see what stuck. And so community health and program evaluation and planning was kind of where I started.
Okay. And then kind of going on to the classes that you took, but was there a faculty connection or a lab or a project that you also may have run into that kind of helped you at GPH?
Yeah, so I did a lot of different things at GPH. I had multiple different internships, all which I think helped in certain ways. Like I had an internship between my first and second year with the Fortune Society, which is a nonprofit in Queens that helps people who are being released from Rikers to find healthcare and housing and all of these things. And I was working on health policy work with them. I worked with Health Right International, which is obviously a big partner with NYU, and was doing kind of grant writing and things with them. I worked at Bellevue Hospital on a substance use prevention program that they were starting. And so I just did kind of a lot of different things because I didn't have a great idea of what I wanted to do. So I was like, let me try a million things and see kind of what I like. So there was a lot of experience at GPH that helped me, but what eventually helped me get the job at Partnership was just having that program planning and evaluation experience through my classes, because they needed someone on the team who is public health. Everyone else that I work with is a psychologist or a psychiatrist by training. So they needed someone who had done kind of any public health work, and GPH classes was enough for me to get that job.
That's good. And it also sounds like you trying different things helped, even though it didn't stick, but it helped. And I feel like a lot of the students who are here, or like just in general, they should be also doing that. I feel like a lot of the alum come and tell them to try different things, because you never know what might stick or what you might end up that you like, that you didn't like. So I think that's part of it as well.
Yeah, absolutely.
Yeah. Okay, so a little bit about the role. Can you tell us what like a day in the life for you is, like what your schedule would look like?
Yeah, so I work from our Midtown office just once a week. So most of the time I'm working from home, which is fabulous for the work-life balance. But so mainly what we're doing right now is I have contracts and grants with a lot of different partners across the US. So right now we have projects with partners in New Jersey and New York and Arizona and Oregon. So a lot of the time I'm developing trainings for these people in Arizona and Oregon and elsewhere. I'm delivering trainings to parents and other professionals. I also help with a lot of partnerships educational resources. So I'm writing scripts and recording YouTube videos for parents on how to, keep their kids safe. And like, you had to get me a room for right after this, because like Facebook gave us a ton of grant money to do prevention trainings kind of anywhere that we wanted to.
Oh, wow.
So I have a meeting with a nonprofit in Michigan where we're hopefully going to be partnering with them to help train Michigan parents and kind of these evidence-based practices that we know work for substance use prevention for young people. So it's a lot of kind of just like wheeling and dealing across the country. Like, we have all of this great information. How do we get it into the hands of people that need it? We're doing a lot of work right now on trying to get opioid settlement funds to go towards prevention efforts. So we are presenting at conferences and things. So every day is kind of different, but it's a lot of presenting PowerPoints and trainings and trying to kind of get the word out about prevention in any way that we can.
Okay. And I know that when we spoke in our little preview chat, I asked you about like skills that you would recommend for students, and you mentioned communicating. So that continues to seem like something that's really big for your role, and not just like the basic knowing how to speak with somebody, but how important it is for your specific role to talk to everyone.
Definitely. So like it sounds cliche and really easy, but like knowing how to talk to kids versus parents versus professionals is hard sometimes. And it's a skill that you can practice, a really important one. And also kind of an important skill is just being able to present to different audiences. I know that public speaking is not everyone's forte. It certainly was not mine for a long time. But again, it's something that you can practice. It's like not something that, if it's not intuitive, it's going to be a detriment forever. So that's another really important skill kind of day to day to have.
Okay. And now I know you can't explain or maybe tell too much detail, but could you share like a recent success story that you particularly are proud of that you've done with your role?
Yeah, so just kind of an easy one. Last month, so October is Prevention Month. I think probably all of us know that. And so at Partnership, we wanted to do a kind of short social media campaign about prevention for parents. And so I had to distill a ton of research into 4 3-minute videos, which was really hard. But so we recorded them and put them out there, and they were basically kind of like, what is the most pressing thing that we want parents to know about substance use prevention? And so like easy, actionable, everyday steps that parents can take to try to improve the relationship that they have with their teens, but also kind of navigate the substance use landscape these days. And we got a ton of really great feedback from parents about it. And that social media presence is like helping us to reach more families. And so we had a goal for this year at Partnership that we wanted to reach like 6.5 million families with our educational resources and through our helpline and some of our other services. And I think we just surpassed like 10 million families that we reached.
Wow.
So that feels like a huge win that I was just like a very small part of. But, you know, in public health, when we have all of this good research and information, it's tough to translate it into actionable steps that the public can take that's actually going to make their lives better. And so we're really trying to do that. And I think we're doing a better job kind of this year, especially using social media than we have in the past. So that's a kind of recent win.
That's awesome. Okay. And then kind of going into a moment that you're proud of, how do you measure success when it comes to prevention and behavioral health interventions?
So it's really hard, at least with like primary prevention. You know, our success is the lack of an outcome.
Yeah.
Like, if we do our jobs right, blank amount of young people are not going to become addicted to substances versus the number that would have if they didn't get any kind of preventive services. So it's hard to measure, like, it's hard to quantify what doesn't happen.
Yeah.
And so that's tough, but like that's the problem kind of with public health everywhere. When it works really well, you don't see it.
Yeah.
But what we can measure are some of these upstream protective factors. So these things that we know will reduce the risk that a young person will grow up to become addicted to substances. So we can measure, you know, how many kids have an adult mentor that they trust. We can measure social capital in a community. We can measure someone's resiliency, and all of these things that we know when we increase those will decrease substance use and addiction in a community. And so we know that these upstream prevention efforts are making a difference when it comes to the number of young people that are using substances early in life, which is like our main metric for whether we're doing any good or not.
Right.
So it's hard, but there are some things that we can measure.
Okay. And then kind of going into like the trends and the healthcare insights, what are some of the trends that you're seeing with the substance use prevention, and how is the field evolving?
Yeah, so it's changed a lot, even in like the 10 years that I've been working. So more young people are abstaining from substances than ever before. Every year, the number of young people who make it to their senior year of high school without using any substance, including nicotine, marijuana, alcohol, is a larger proportion. It's getting more and more every year, which is great news.
Yeah.
But on the other hand, the substance use landscape, the substances that kids are using are more dangerous than ever. So we have high potency THC, we have an illegal drug supply that is contaminated with fentanyl, with these, fake pharmaceutical pills. So like the landscape's more dangerous, but less young people are using.
Right.
Pizza.
Oh, the food is here. They actually came.
And so the kind of the progress with like less young people using substances is due to a ton of different factors, a lot of societal factors. But part of it is because our prevention efforts have gotten better.
Yeah.
You know, we know now that just say no and scare tactics and like the PSAs of the 80s and 90s weren't super effective. And so we know that our prevention efforts have to start earlier and be a lot more broad and comprehensive. So like teaching high school students what drugs do to their body and the risks involved is necessary, but it's by no means enough.
Yeah.
So prevention is getting so much more broad, and we're starting so much earlier than before and having just a really kind of expansive view of what prevention entails, to where it's really about creating the healthy, supportive environments so that infants are growing up in a non-risky situation to where they never engage in risk behaviors in the first place. And so it's a different view on substance use prevention. It's a really kind of a much larger concept than it used to be just like maybe 20 years ago.
Yeah. I was just adding on that. I was just about to ask, just hearing you speak about the kind of the way it's looking at now. Are you guys now reaching out to are you noticing you're reaching out to even the younger crowds? Like, and is that something that you're purposely doing? Because, as we all know, when things start, they can start at a young age, and they start in the house from what kids see, and then they grow up to think things are normal.
Oh yeah. I mean, we call substance use disorders now a pediatric onset disease. Yeah. So we know that the vast majority of young people who go on to develop addiction will start using substances before the age of 18. Yeah. And so we're thinking so much earlier now, like a lifespan approach. We're thinking generations ahead now, where we have a whole research team devoted to substance use prevention for pregnant and postpartum people, because the idea is if mom is using substances, that puts baby at risk for using substances further down the line. So if we can get moms the help that they need, that is primary prevention for that next generation. So we're thinking social and emotional development of infants is substance use prevention, so much earlier than most people who are okay, we got to teach 8th graders about marijuana. It's so much bigger than that. And a lot of people are on board with that kind of lifespan early approach, more so than they used to be, which is encouraging. But it does make, it's a huge topic, and it does become kind of abstract and a little too big to handle at times. But
it made me think about how early I kind of heard about it, or just about substance use in general. It was about 7th, 8th grade, maybe 6th grade, but in the grand scheme of things, that's late in a way.
Some of us. I was a DARE kid.
I won the DARE Bear and everything. You wrote an essay.
Yes.
I still have
Did you go to DARE camp?
No, we just had it at school, and it was this couple months long thing, and then we all wrote an essay, and then they choose an essay.
Yeah,
and
I
how
remember
old is
that
that
essay. That's 5th grade for me.
Oh, wow.
Yeah.
Okay.
Yeah, and so it's interesting because there's been a lot of research on the DARE program. Right. It worked for some kids.
Yep.
Didn't work for others, and was detrimental to a very specific group of kids who was kind of already at high risk. And I don't love bringing in law enforcement, making substance use kind of a morality issue and a legal issue when we know it's kind of so much bigger than that. Yeah. But it's so interesting now that that was, I'm not trying to age myself, but when I was in 5th grade, that was 20-something years ago. Yeah. That was what everyone thought substance use prevention was. You have the cop come to your school, teach you about how drugs are bad, and you're going to scare kids enough to where they just won't do it. And we learned through many years of public health program evaluation and research that was not really the case. Yeah. And so we had to try something else. The DARE program still exists. Yeah. It's been kind of revamped and reloaded, and it looks a little bit different. Through some, I think, very well-intentioned program iteration. But, we as preventionists, we know that there needs to be so much more than just that. And we really have to be thinking outside the box rather than just putting all of the responsibility on kids to make the right decisions, because there's so many other factors that go into why someone would be using or trying substances rather than just no one told them it was bad. Right. It's not a very holistic view of the issue. Yeah.
Well, kind of going into why the work that you do often involves addressing these sensitive topics. So how do you engage with the students, the caregivers, and the communities?
So it's hard. I often will go out to communities and be teaching them about fentanyl and the contaminated drug supply. And these communities I know are really against harm reduction, and they don't want to hear about Narcan, and they don't want to hear about test strips. Or we go into a community that has really steadfast beliefs on why they think kids in their community are using drugs. Not always with the evidence behind them.
Right.
And so we have to know what is going to be a message that resonates with them and what's going to be a message that is going to totally turn them off and distrust. And so we want to avoid that. So you have to know who you're talking to. You have to know how to not change your message, but tailor it in a way that's going to be effective for who you're talking to. And one of the things that we do at Partnership is we are never coming at it from a sense of like, this is our opinion, or here's what I think as someone who works in public health. It's very much like, this is what the research says, this is what the science says, this is kind of objectively what we know to be true, and we attribute to all of our sources. If someone wants to know where some of our information comes from, we can show them the reliable source that it comes from. You know, we're never just kind of spouting opinions. It's all based in the science. And so we're really gentle with how we approach these topics. We know that the communities that we're talking to, they're the experts in their own experiences, especially when we're talking to parents. Like, they know their kid more than we ever will. Right. And so we come from not we're the experts and we're here to tell you how to raise your kids, because we know that doesn't work, but coming with a sense of humility, of we want to have a conversation, we want to hear about what you believe to be true about substance use in your community, and let's have a dialogue about how we can, you know, take small steps for improvement that work for you and your community. So there's you always want to be humble in your interactions with community, because we know that just kind of helicoptering in and being like, here's what the CDC says, and then immediately leaving is not an effective approach.
And I think when you kind of think about, again, kind of bringing up upbringings, how different one area could be versus a place like that's 30 minutes away from you, and how the dynamic of even just the neighborhood could be. So having different type conversations with two different places that are even just minutes away from each other.
Yeah, I do a lot of work in New Jersey, and there's like this huge statewide mental health program for young people in New Jersey. It's a really amazing program, and we're helping to train the workforce that's going out into schools and doing that. And so we're training prevention professionals in Newark, and we're training prevention professionals in Asbury Park in like Ocean County, which like not that far away from each other, but those are massively different communities that those prevention professionals are working in. And you know, we're not the expert of that. I can learn as much as I want about Newark, New Jersey, but I'm never going to be an expert in the experience of living there and growing up there. So really trying to make it be a dialogue with who we're training, to where we're giving them what they need.
No, that's really important. Okay, so kind of shifting now into the advice for students overall. Looking back at your time and receiving your MPH, what opportunities or experiences do you wish you would have taken more advantage of?
I think this is kind of a lame answer, but I wish that I'd taken more biostats, and I wish that I had like kept my notes from biostats so that I didn't immediately forget it all upon graduation. Like, I don't do much quantitative work these days. The research that I do mostly is qualitative, but it still does feel bad that I didn't really keep up with those skills as much as I probably should have. And, you know, I was community and international health, so I didn't have to take that second semester of biostats, and I didn't have to take Epi 2, but I kind of wish that I had.
Yeah, that's fair.
Just because those are the types of things that, like, it's obviously accessible when you're in grad school, but like once you graduate, like teaching yourself that stuff gets really hard, and you got to be disciplined, and I'm not someone like that. So wish that I had kind of pushed myself to like take those classes anyway and like keep some of the notes and keep up with it. That would have been helpful.
That's fair. Okay. Well, kind of slowly wrapping this up on a little advice. What's one advice that you give students about building and fulfilling the purpose-driven career path in the public health field?
So public health is like really great in that even on days where I'm doing what feels like kind of asinine work that's not directly helping somebody, where I'm like updating our PowerPoint template, or I'm like writing a proposal for a conference that I want to speak at, and like not doing like on the ground public health work, I'm still working for a nonprofit that I think has a morally good North Star. And so I feel like I'm working towards a greater good, and I'm working for an organization that is working towards a greater good, which feels really good. And that is something that I think I need in my professional life to have kind of fulfillment. But nonprofits are not perfect organizations. It's still work. Yeah. And so you don't want to have it become your entire life and kind of the only thing that you have. So I feel like it's not great advice because it's hard to do, but trying to cultivate a sense of joy and meaning outside of your work so that you're able to come to your work and give your best self to the cause is really important. You know, you have to take care of yourself too. I think in public health, especially those of us who work in the nonprofit space, there's often this idea that like it's a race to see who can be the most selfless and who can give the most of themselves to the work and the cause. And so you do see people get burnt out, and you see people kind of become jaded and desensitized and no longer kind of have the fire that they used to have. So you got to take care of yourself, and you got to, you know, again, cliche, but like you can't pour from an empty cup. And like if you're on a plane, you got to put your oxygen mask on first, you know, all of that. But it is true, and it's important. And in public health, I think we kind of forget that sometimes. Because it's like a moral good that we're reaching towards, but you got to save some of it for yourself.
I absolutely agree. I feel like my advisees, they can attest to me telling them repeatedly, you can't do your best personally if you're not taking care of yourself. Definitely. You know what I mean? So no class, no project. It's going to be at 100% when you have so much on your mind, on your plate, and you're not even saving like a moment for yourself. So I feel like that goes with everything, life, work, anything. Yeah. So I think that's great advice. None of that. Last question is really more about the opportunities that students have here as far as internships, access to faculty, to reaching out. What is some advice that you kind of went through and that you would give them about taking the opportunities that they have here on campus or here at GPH in general?
I mean, I think I was someone when I was in grad school who was really intimidated by everyone saying, like, you have to network and you have to make these connections. It's true, but like your classwork can really take you very far if you're not someone who's going to immediately have a faculty member that you can join their lab, or you can immediately get an internship with them. So don't discount your work in class. Like, save it, use it for interviews and job opportunities. But also at the same time, if you find someone's work interesting, like if you have a professor that's doing cool research and you think it's very interesting, let them know. Yeah. Professors and all public health practitioners love to talk about their work and love to talk about how they got there. And so don't be afraid to just kind of reach out with that sense. And I mean, just you never know who's going to come back around. One of my internships that I had with NYU Langone and Bellevue Hospital, my preceptor there I only worked with her for one semester. I didn't know anything. It was my first semester of grad school. I was kind of useless, but we had a great relationship. And now, almost 10 years later, we're collaborators because we work in the same space. She remembered me as like her baby little intern first year 10 years ago. And so now we're working together and trying to go in on grants together. And I wasn't the best intern 10 years ago because I really didn't know what I was doing. But she knew that she liked me and she knew that I was nice. And so 10 years later, when my name comes up again, she's like, oh, I remember that girl from NYU. And so little moments like that, you know, you don't want to burn any bridges. But, you know, keep emails and contacts from people that you work with and people that you like. Throw out an email to someone if you think their research is cool. You know, there's a lot that you can do that seems very small, but is a lot more actionable than like you have to go to this really formal networking event and create a lasting professional impression, which was always very intimidating to me, and I was not very good at that. But there's smaller things that you can do to kind of get a hook in and a foot in the door.
Yeah. Well, thank you so much, Cori. I know we went off a little bit on some of the questions because I was fully into it. But I appreciate you coming here and speaking with everybody, speaking with us. I think these events personally are so great, and I hope they get bigger because there's one part of being in class and kind of, you know, speaking with your peers, but hearing from someone that was literally just them, but also like sharing their experiences, maybe some things you guys heard here that you had never even thought about before. I often find that students are like, I didn't even think about that. Or maybe you're not even in the same concentration, but you are like, maybe I want to look into that. You know what I mean? So I feel like just hearing from you, hearing from alum in general is great, and I appreciate you being here, so thank you.
Thank you for
and I hope you
having me.
guys appreciated this too. And we can just eat finally, but also if you have any questions for Cori, I know she has a meeting at 2, but we have a little bit of time, but if you have any questions for her, you absolutely can ask. And thank you. Thanks.